Hello and welcome everyone to today's webinar, An Accessibility Origin Story, How Baptist Health Enhances the Digital Experience for Healthcare Consumers with Disabilities. Thank you for taking time out of your busy day to join us. My name is Farrah Hunt Thompson and I am with Greystone and the moderator of this webinar. If you would like to tweet during this presentation, you can use hashtag BackstagePass, and after the presentation, we'll be taking questions from attendees. To ask your question, please use the question box on the right side of the screen. And due to the audience size today, attendees will be in listen mode only to cut down on background noises. I'd like to welcome our presenters today from Baptist Health, Erik Helton, and from Essential Accessibility, Simon Demir. Simon is the founder and CEO of Essential Accessibility, the provider of a comprehensive accessibility solutions that enhances the digital customer experience for people with disabilities. Essential Accessibility's innovative market-driven approach is informed by Simon's healthcare industry experience as a business development executive with a network provider and owner of an outpatient rehabilitative services facility. Essential Accessibility enables organizations to build an inclusive, disability-friendly digital presence and empower people with disabilities. Erik Helton is the manager of digital optimization at Baptist Health based in Louisville, Kentucky, with over 20 years of leadership experience. Erik has experience with executing new media, such as digital and online advertising and marketing for all size organizations. Erik is Google AdWords and Analytics certified, and he also has the experience with digital display advertising, high-impact rich media, mobile marketing and advertising, online audio, in-stream video, email marketing, social media marketing, and social commerce sites. He has led strategy and execution for usability and user experience testing, conversion rate optimization, and website goal and analytics tracking. Thank you to our presenters for being here today. And as a reminder, we'll be taking Q&A after the presentation from our panel of experts. And now we'll begin with Erik Helton, who will share with us Baptist Health's accessibility origin story, showcasing how they are able to enhance the digital experience for healthcare consumers with disabilities. Over to you, Erik.
Thanks, Sarah. First, a little bit about Baptist Health. Founded in 1924, we're an 8-hospital system headquartered in Louisville, Kentucky, with locations across the state of Kentucky and in southern Indiana. We have over 300 points of care that range from our hospitals, medical group, home care, virtual care, express, and urgent care. Our promise to the communities we serve is that we treat you the way we would want to be treated every time and at every Baptist Health location. With our shared vision, we focus on 4 pillars: expand, excel, align, and advance. Our partnership with Essential Accessibility falls under our excel pillar, making sure that we do not exclude any users, regardless of ability, coming to our website and the communities that we serve. A little about our digital optimization team and purpose. We continuously monitor and optimize our website based on our goals. This ranges from direct and organic traffic, as well as inbound marketing and advertising efforts. Focus on increasing conversion rates and overall customer engagement as part of our roadmap. Identify how we can better improve the experience for our users by reducing friction. Use SEO best practices to increase organic traffic to baptisthealth.com. Some of the areas that I am responsible for are digital campaign coordination and optimization, monitoring channel, creative, targeting across our campaigns and making recommendations based on the goals, conversion rate optimization, testing variables to drive higher conversions, video optimization, optimizing titles, placements, and execution on baptisthealth.com, and offsite channels like YouTube. Our enterprise measurement strategy and how we monitor and report out on our different channels and tactics. Usability on the site falls under my wheelhouse. We strive to create user journey that ensures the user gets to their end goal with minimal friction. Managing the execution of our accessibility program through partners like Essential Accessibility. Some of our top projects that we have going on right now are in the areas that drive better user experience. As you will see on the next slide, we're almost to the end of our initial accessibility audit and execution project with Essential Accessibility. Website usability and feedback, utilizing the tools on our website to ensure we create an overall positive experience for the user. Reporting was recently updated to align with our roadmap. Tracking and reporting are very important to our system. This is a way to ensure our efforts are resulting in positive results. Here is our journey with what our journey with Essential Accessibility looks like. We have been a longtime partner with them and have had their assistive technology on our site since July of 2010. We updated the channel landing page in June 2017, and from that we started discussion around having a compliance and accessibility audit completed. That took place in September of the same year. From January through March of 2018, Essential Accessibility completed and delivered 4 rounds of audit reports. As of last month, we are nearly complete with the execution of those findings. And then today we're on the webinar. Our accessibility goals are broken into 4 categories. The first being customer experience. How are we doing as it pertains to being compliant? Next is diversity and inclusion. We want to make sure that any user coming to baptisthealth.com can access the information they want or need. Legal. Reduce any exposure for our business. Patients and families. Deliver assistive technology right on the site at no cost to the user. All of that said, it just means that we do the right thing. Here is a website accessibility audit and what it looks like. I'm not going to lie, it can be slightly overwhelming when you first take a look at this. After you understand the layout, set prioritization based on the severity, which is at the top right circle, it is much easier to swallow. The other areas that help with the issue is with the issue name and description, which is the top left circle, and a screenshot of the element or item that needs to be addressed, which is in the center. This, along with the rationale and suggestion, make the process much easier. One area that we had a lot of opportunity with was video placement on our site. We identified that a user that watches a video on our site will convert 20% higher versus a user that does not watch a video. As mentioned early in the presentation, we put a lot of focus on optimizing our video on and off site. Even after all those efforts, Essential Accessibility identified a gap in how we're embedding the videos. We worked with Wistia, the company we use to host our videos, and identified the best way to embed videos on our site, regardless of ability can view or listen or video content. Here's an example of the assistive technology icon on our website. When you click on the icon, it takes you to the co-branded page with Essential Accessibility. We have a video to demonstrate how the assistive technology works. After the video, Simon will share a little bit more about the disability market.
Thank you, Eric. We're going to play a demonstration right now on how the assistive technology, how it appears from the user's perspective, and how it can be leveraged to overcome different limitations here.
The Essential Accessibility toolbar provides an array of assistive technology right across the top of the dashboard on someone's computers. Everything from screen reading technology all the way through to a hands-free solution is available instantly and at no cost to the end user. So let's try out a few of the features here. So the screen reading, you can click.
Patients and visitors, locations, services.
So you've got instant text-to-speech available. And of course, you can combine all the solutions together. So you can combine, for example, the screen reading along with the hands-free solutions. So let's test those out. So the webcam quickly locks onto me in about 3 seconds, and I have control of the cursor just by moving my head. So I'll show you on the screen above that I'm just moving my head left to right or up and down, and of course the cursor is tracking to my head movements. And if I want to click through, let's say, to services, I hover over the link and it clicks it for me, and away we go. And again, you can combine the solutions. So if we want to turn on the screen reader at the same time, we can do so.
Speech, patients and visitors. Speech over is enabled. Click to disable it.
Okay. Let's turn this off. And for switch users, think of anyone with a dexterity impairment that may need the complete hands-free solution. We have XY mouse. So it's for someone who can click or is using a switch but may not have the ability to move from A to B. Think of Parkinson's, for example. So the X bar moves from top to bottom. The second click creates the target, and that target now represents your clickable area. And of course, there's even a virtual keyboard. And again, you can use all the other solutions embedded in the virtual keyboard. And of course, this is word prediction across here. We've even added voice commands. Let's go back to the home page here. Show crossbars. Move down. Move up. Stop moving. Hide crossbars. Show grid. Go to G3. Go to H3. Hide grid. So you can see the array of assistive technology all readily available, easily accessible across the top of the dashboard here on somebody's computer. The essential accessibility tool.
So what we just saw there, folks, was a demonstration of assistive technology featured right on the Baptist Health homepage. And again, it provides the communication supports, the technologies, the functionalities that are of benefit to people who have difficulty typing because of dexterity limitations. They may have difficulty reading or just navigating a site generally. So that solution is featured right on the site, and it allows the user in that simple browsing-based interface to avail themselves of whatever functionality it is required to overcome their limitations. So now, we've talked about compliance, we've talked about the types of initiatives you need to implement as part of the components of a digital accessibility program. Now we're gonna basically go a little bit higher level on the motivations to do this that go beyond the legal requirements and make the case for enhancing the customer experience across the board for a total audience inclusive of people with disabilities. So first of all, the real reason you're going to want to pay attention and implement a program like this is because of the market opportunity. The disability market is regarded as the largest minority market of the world, and it now comprises well over 1 billion people globally. And if you take it to, in the American context specifically, well over 60 million people within the US self-identify as having a disability right on the census. So this isn't a label, this isn't an uncertain measurement, this is a hard fact. Well over 60 million people self-identify, which comprises about 1 in 5, close to 1 in 5 Americans. So that's a sizable market indeed. But when you address the needs of people with disabilities, when you cater to this segment and you demonstrate that commitment, you don't just resonate with this audience, you quite often also resonate with the friends and family members of people with disabilities, folks who have an emotional connection to disability, who are touched by it in some way. So when you project that disability-friendly brand, it resonates beyond the segment as well. Quite often, though, you will hear feedback in conferences and webinars that, yes, but isn't it true that people with disabilities don't really have a lot of money? How big could this market really be? And in fact, it is true that on average, the spend of the disability market on average is below the below other segments because of socioeconomic and other factors, primarily related to a higher unemployment rate. But nevertheless, when you look at the collective spend in aggregate, when you look at the fact that the needs-based spend around necessities like clothing, food, and of course, transportation and healthcare, the subject of this webinar, not only is the spend on a par, it's potentially on an even higher level. So disabuse yourself of the notion that people with disabilities do not have a spend, do not have resources, because that is completely not true. So what is digital accessibility? Why are we doing this? What is it? It's basically, it's anything to do with accessing electronic information. So when you're a member of a production team, you're in marketing, customer service, you're developing experiences, we know that everything is migrating to the digital channel. You've got to factor this in to your activities on an ongoing basis. To give some additional perspective on what we're talking about, in other words, map it to specific needs and personas, some examples are low vision, where a person can see to a certain extent, but they can't make out the contrast necessarily. That's where it's important to have proper contrast ratios that are sufficiently pronounced. If you talk about someone who's a blind user, well, if you're reading the text on the web page and it comes across with a screen reader and it comes across an image, that individual is not going to understand what's being represented. And we all know the power of imagery, and we all want to make use of it in our marketing collateral, but you're leaving a part of your audience behind if you're not explaining what's being depicted. When you think of folks with physical limitations, dexterity limitations, these can arise from a variety of conditions like multiple sclerosis, ALS, arthritis, very common conditions. You want to ensure that your properties can be navigated with minimal dexterity. For example, just tabbing on the keyboard. If an individual has difficulty hearing, of course, in a more obvious example, you should be captioning your videos. And I do want to point out that when you caption, you don't want to rely on automated captioning because of the errors that can be generated and the imperfections in the technology. You want to make sure that you're getting your captions done properly with human translation. And finally, cognitive, that's all about ensuring that it's readable, understandable, clear for navigation purposes, and that's a function too of your audience, knowing the complexities of what it is you're trying to accomplish through your digital channel. But those are the broad, big buckets that you sort of look at this when you're tackling projects in the context of digital accessibility. So here's just some statistics there when you're championing the case for developing an accessibility program. You're communicating it if you're not quite persuaded yet, or executives in your organizations still don't fully understand the business case. Well, here's some more statistics that will resonate and map specifically in the healthcare context. You know, barriers faced by people with disabilities go beyond, of course, traditional digital. I mean, we've got physical ones, which is the legacy barriers that we grew up with, that we're more probably familiar with. We've got issues related to communications that we want to ensure that when you think of a speaker in a hospital announcing a fire alert. I mean, that's why there are alternative ways of communicating the alarms through flashing lights, for example. When you think of policies, you want to ensure that your policies are completely inclusive and that they are factoring in the needs of this segment and their various subcomponents and different personas. And of course, digital is more than just your mobile apps and your website. It's increasingly, especially in healthcare, things like booking your appointment, your test results, the seamlessness with the lab services you provide. Are you providing these report summaries in a PDF format? Are they accessible to someone who's blind or is using a screen reader? So this is the broader, bigger picture related to digital accessibility. Regulations, of course, there's a whole different body of regulations that apply to different sectors. The general one is the ADA, the Americans with Disabilities Act. Specific to healthcare, we've got Section 1557 about the provisioning of electronic information, and of course the familiar, or maybe more familiar, Section 508 related to the provision of services where there's a government payor. When the government is the funder or the client, the government mandates that, the federal government, that you must ensure that whatever services you're providing is accessible to someone with a disability. So when you think of Medicare, for example, as most hospitals providing Medicare, you're going to be obligated as well under the 508 requirements to adhere to what's necessary there. Okay, so we've now done a high-level overview. We've talked about what is accessibility, what are the reasons to do it, the legal case, the customer experience case, the market opportunity, the brand burnishing possibilities. You're sold. You're drinking the Kool-Aid. What do you do next? How do you get onto the path? Well, first of all, you're going to want to secure a partner to help you tackle this project and to evaluate your assets to make a determination on where it is you stand. Second, the best practice is going to call for crafting a statement that acknowledges your understanding, gives an honest expression to where you are at now, the path you are on, to basically map out what it is you're intending to do as an organization, to convey that you have a sensibility around accessibility and that you are working to ensure and achieve and maintain compliance. So it used to be when the first wave of digital, that you built your website and your work was done and that was it. But now we live in a very dynamically oriented digital universe where we're constantly producing new content, constantly updating, dynamically refreshing. So it is critical that you do not take the ad hoc one-off project view of web accessibility in the context of your efforts. This is ongoing. So you need to have a monitoring program into effect to make sure you don't just continually update and ensure that you're meeting the standards on an ongoing basis, but you're staying abreast of the changing of the standards and developments on that front. So when you're producing things like documents, like the aforementioned lab report, when you're producing collateral related to other activities, you got to ensure that these are created like PDFs with accessibility in mind. When you're producing your content, your video content, captioning, you saw the example of assistive technology in the demo. That's for folks who basically require it to get online. They need assistive technology to overcome their limitation, and putting a tag on a picture, ensuring your websites are properly designed, will not be sufficient for that segment. They require tools that will help them overcome their limitations as well. And finally, what you want to do is give prominent expression to your brand, everything you're doing in a disability context that conveys the commitment and projects that you're a disability-friendly, welcoming brand. So as a vendor in this space, as a partner to many of the world's leading brands, and as privileged to work with organizations like Baptist, this gives you some perspective on the core pillars of our program, our value proposition in the provisioning of accessibility as a service. Broad, diverse team of folks with a range of skill sets, technology, experience, testing, accessibility, engineering knowledge, all of the resources that you require to implement this type of a program on an initial basis and to keep it going to achieve, to maintain, and compliance. So, want to keep it high level. I want to keep it simple for the takeaways. What do you really need to do? First and foremost, I want you to fixate on the necessity, the importance of enhancing the digital experience. There's a strategic imperative there. Acknowledge it. Find a partner to help you out. While in theory you could do this in-house, in reality it just doesn't ever seem to go that well for anyone who tries it. It's very expensive, very difficult. It's far more economical to get a partner that's done this hundreds of times over to guide you on the path. And take the view that you're not doing this just for legal. Go beyond minimum legal requirements, for example, by featuring things like communication supports, assistive technology to ensure that you do not leave anyone behind. You don't want to put all this effort in just to meet the minimum legal standards. Second, when you get to that level, you've achieved and you're maintaining compliance. As your digital team becomes more knowledgeable, you're going to embed accessibility into your process on an ongoing basis. It's going to be imbued into your DNA. You're going to want to ensure that you, as part of that maintenance program, as we can't stress enough, that you're adhering to the latest legal requirements, you're staying abreast. And for members of our audience that are working at nonprofit hospitals, know this: the provisioning of assistive technology can also make you eligible as for your community benefit reporting, the Form 990H, because it's part of giving back to the community and providing supportive services. So keep that in mind too when it comes to funding time and you're looking at how to report it to your various stakeholders in your IRS forms. Finally, you're doing digital accessibility now to the largest minority group in the world. You've crafted a statement that's giving expression to your commitment. Don't stop at digital. The visibility you're going to bring to the program through these efforts are going to resonate with your internally with your staff. It's going to resonate with your patients, your customers, and you should be using this to basically inspire the organization to keep accessibility in mind across the board in the brick and mortar context, from the policy development standpoint, and everything else. So something I like to stress with healthcare that I don't know what I'm going to end on is that healthcare professionals and executives, have an attitude that they understand disability already, because many of your patients have disabilities. I mean, the first organizations in the world that would welcome you with a wheelchair when you pulled up or crutches were hospitals. I mean, so obviously hospitals understand disability, but there's a nuance, there's a distinction between understanding someone with a disability from the standpoint of treating them as a patient in the clinical context versus recognizing the efforts that you need to take to address needs as a customer. So keep that thought in mind when you're going back, and when you use this to inform your efforts to get champions on board and to implement these programs going forward. So with that in mind, I'm going to hand it back to Farah, who's going to now basically mediate some sort of a question session, Q&A. Thank you.
Great. Thanks so much, Simon, and thank you and both Erik for such a great presentation. And as Simon said, at this point, we're going to open it up for questions. Again, you can submit your questions through the question box on the right side of your screen. Our first question is for Erik. Erik, since you joined after the accessibility journey began, can you tell us a bit about your familiarity with accessibility before and now?
Yeah, sure. My overall familiarity with it was minimal. A lot of our websites that we worked on prior to coming to Baptist were smaller, medium to size businesses. So as far as the execution on it was fairly easy. However, when you're working with a website that's got close to 9,000 pages on it, it gets a little bit more tricky. So when we partnered with Essential Accessibility to do our audit, as mentioned before, it was extremely overwhelming. But with the information they provided, it made it much easier to go through and execute, and has also helped me better understand areas of the website that need to have more focus around accessibility. And we've even had some internal procedure changes so that as we are uploading, like the example of the video, we're following some of the more types of embed that will actually be more easier for users to access that video. So my knowledge is much more than what it was, but with partners like Essential Accessibility, you don't have to be the expert in the field. You've got them to lean on.
And someone also asked, Erik, is it easier to get buy-in for something like this because you work at a mission-driven organization, or is it always tough to get budget for any web technology?
I would say that we're always struggling to get budget dollars for any type of project that we're working on. But for a project and partnership like this, it is, I'm not going to say it's easy, but Baptist wants to do the right thing for our community. So with this partnership, we're given accessibility using the assistive technology tool on our site. So it's just the right thing to do. So I wouldn't say it's easy, but it's definitely the right thing. And we've got buy-in from our leadership on that.
And Simon, a question came in regarding the video that was shown. When the demonstration of the software was happening, showing the person using the Baptist Health website, someone asked about the technology being shown and the software behind it. Can you speak to that? And is that Essential Accessibility's technology?
Sure, yes. So I'm going to take just a couple of minutes. So first of all, quite often people with disabilities will need what's called assistive technology to get online. So you could require a screen reader if you're blind, a magnifier if you have low vision. If you're paralyzed, someone like, think of the late Stephen Hawking. We all saw him with this elaborate contraption. He had a hardware-based solution to move the mouse so he could type words on the screen and communicate. So assistive technology is what folks with disabilities have always, not everyone, but many folks with disabilities have required to get online. And that's, when the web came along, what that drove was the importance of coding the website so that they're interoperable and they play nice with the software. So what we showed you there is the fact is assistive technology is quite expensive. Increasingly, functionality is being built into the operating systems, but it leaves much to be desired, and the many folks require AT, and they don't have it, they can't afford it, they don't know where to get it, they're not aware of it. There's a whole bunch of different, anecdotes and stories around that. So what we've done is we came up with a comprehensive solution, assistive technology, that is not sold to the end user as is traditionally, like Stephen Hawking, who had a team from Intel build his solution from scratch. Rather, we developed a comprehensive, the closest thing to a one-size-fits-all. It doesn't address every need, but it's extremely comprehensive. And organizations like Baptist can feature it right on the website in a turnkey fashion. So it's available there for the benefit of any patient, purchaser, customer who comes with the website. So what you were seeing was that app in action. It's analogous, to give you a brick and mortar analogy. Imagine showing up at the hospital and they give you a motor scooter to come in because you're having trouble walking. Well, this assistive technology is analogous to that. It's a welcoming tool that gives you alternative ways to navigate the site, and that's what you were seeing. You were seeing this solution in action that is featured on the Baptist site. And when the user takes it and avails themselves of it, they not only can they surf the Baptist site, but they can then use it to do other things and visit other websites too. So it's extremely empowering. It's got a the impact, the social impact is very, very compelling.
And does the tool extend to the electronic health record for patients as well?
Sorry, could you please repeat the last part?
I'm sorry?
Could you please repeat the last part?
Yeah. Does the accessibility tool, does it extend to a patient's electronic health record?
Oh, here, they can use the dashboard, like that interface. They can use it on an Android device, they can use it on a Mac, on a PC, and when they use it, they can do anything that's available online, they can use that tool to access. So if their electronic medical record is accessible via a website, a portal, it will allow them to access it. So yes, the answer.
And Erik, and you're sourcing the technology through the Essential Accessibility tool, correct?
Yes, that's correct.
And Simon, for people who are interested in the technology and interested in the tool, where can they learn more about the tool and also just more about Essential Accessibility?
I just encourage them to reach out, on one of our web forums. I guess just go to essentialaccessibility.com, and just you can reach out to us very easily there. There might be an address here I can click up. If you go to the footer of the Baptist Health website as well, you can see the icon right in the bottom, so you can see what the technology is, and you can get you can link to us through there as well.
And what is an average timeline for a project like this? Is it best to start in small chunks? How do you guys approach that?
You know what? I mean, to initiate the project or to actually get to the level of compliance. I mean, we see everything. You see organizations. You see, it's all a function of where the purchaser, the organization is in terms of securing the commitment to go ahead. If the organization's already had the internal meetings and they made the determination they're implementing a program, we can get started right away and get you on the path. I mean, we're capable of moving as quickly as any organization. But typically, you're going to have you've got the stages of an organization deciding where are they at with respect to web accessibility. Are they doing this because of a proactive like a digital officer has stumbled on it, or are they responding to a legal challenge that there's been a lawsuit? So there are a lot of different scenarios, but the urgency again is a function of the resources and the attention. Sometimes you got organizations that are highly committed, but they've got so many digital properties that can be a rate limiting factor. So it's not the fact that they're lacking commitment or resources, it's just the scope of the engagement is massive. And other times you've got simpler, so it runs the gamut, to be quite honest. But generally you're getting on a path to a compliance program. Typically is going to take to implement meaningful change on the actual digital front and your core properties is typically going to take at least 3 months.
And we had an attendee ask, they said, we have a user test planned later this year with screen reader users doing a few tasks on their site. Any insights or important areas to look at with the screen reader?
Yes, I would take the view, it's important, and this is something that testers forget. When testing a site, you've got to look at it from the standpoint of what is the statistically most likely paths or flow that the user is going to engage in when they're visiting your site. So you don't want to test, for example, some part of your site with that no one ever goes to. You want to test the part of the sites that's the highest level of engagement. So, in retail, to use an example, it would be the process of making a purchase and going to the shopping cart. So you want to establish a testing flow that maps to the most frequent pathways that your patients are engaging in. So, for example, if patients need to fill out a registration form before they can be admitted, that's a very critical path-dependent sort of step that you've got to look at. You would want to focus on that. You wouldn't want to focus on you'd want to focus on that before you draw attention to an obscure part of your site where you're talking about something that no one's really reading about anywhere near the same degree. So just look at the priority areas of your site. What are the things that are most critical to your patients, and what are the paths that they're most likely to follow and prioritize on that basis? And that's how we approach any engagement. You go from you prioritize.
And if someone was to go to the Baptist Health site to look at the accessibility dashboard, how would they find it and open it?
They just go to the homepage. I believe it's in the footer. There's a recognizable, intuitively familiar icon related to accessibility. Just click it, and everything is self-explanatory from there.
Great. That's great. Thanks so much. I want to thank you guys for joining us today. And again, thank you to our presenters, Simon and Erik. This information was great. You'll be receiving a short survey at the end of the presentation, if you don't mind filling that out quickly. And also everyone will receive an email tomorrow with this presentation accessible if you want to go back and review it once more. And once again, if you have any questions for Essential Accessibility or Erik, feel free to reach out to them or myself, and I can get you in touch with them. Thank you once again, everyone, and we hope you have a great day.
Thank you, everybody.